support programs, case management, and medication management in outpatient clinics. Consider each of the following clients. Which type of service is the least restrictive yet appropriate? Here, the client says to the nurse that he's been feeling so down lately that life isn't worth living. The nurse responds by asking if he has considered hurting himself or ending his life. The client responds by saying that there's a bridge by his house and that it would be such an easy way to end the pain. Since the client is suicidal, he will need support to prevent self-harm. Inpatient hospitalization is necessary. In this scenario, the client says she's just so tired all the time. Nothing is going right, and it just seems to be getting worse. The nurse asks if she's been sleeping well. The client responds that she sleeps all the time, but that it's not restful. The nurse asks if she's been eating regularly. The client tells the nurse that she doesn't feel like eating, that she'll cook for the kids, but she's just not interested in eating. She's lost 10 pounds in the last couple of weeks. The nurse tells the client that the doctor prescribed an antidepressant, but it doesn't have an immediate effect, and tells the client to take it as directed for 2 to 3 weeks. The nurse will make an appointment for the client to come back so they can see how she's doing then. A client with depression can receive treatment on an outpatient basis unless the client is unable to maintain safety in her environment. In this situation, the client says he hasn't had a drink for almost a day and that he's so shaky. The nurse responds by asking if he's had anything to eat. The client says he's so nauseated he couldn't possibly eat anything. The nurse takes the vitals, pulse 96, temp 99.2, blood pressure 152/100. This client may be experiencing alcohol withdrawal, so further assessment for hospitalization is needed to prevent the risk for injury and for safe alcohol detoxification. What's the number one priority for mental health clients? Consider Maslow's hierarchy of needs. As you can see, physiologic needs are often considered most important. However, in mental health nursing, safety can be more important. A priority nursing problem is risk for harm to self or others. It's this risk that puts safety ahead of physiologic needs for a mental health client. So what can you as a nurse do about safety? First, there is a contract for safety, either a verbal or preferably a written contract made so that the client agrees to avoid inflicting self-harm for a specified time period, and further agrees to contact someone if such thoughts or impulses occur. Other precautions include one-to-one observation if the client is high risk or unable to contract for safety. Maintaining safety in the environment is a priority nursing intervention. You'll need to assess the surrounding environment for things that can lead to potential self-harm. Take this common examination room, for example. What kinds of things in this room could a client use to inflict self-harm? Instruments, alcohol or other chemicals, cords, ropes, belts, sometimes shoelaces, a client's personal belongings, cosmetic mirrors, razors, glass bottles, wire hangers, sharp objects, like a lamp with a light bulb, or how about a trash can with a plastic liner inside? And consider the client occupying the room. Could your depressed client, initially observed to be hunched over and with no eye contact, begin to feel better and gain the energy he needs to harm himself? Manic clients need protection from their own poor judgment and are often too busy to eat or take care of themselves. These clients may pace and wander through the halls. Psychotic clients might harm themselves accidentally because of impaired judgment or by responding to command hallucinations. Restraints are another intervention providing client protection and prevention of harm to self or others. As you know, restraints include the use of medications or chemical restraint, seclusion, one-to-one observation, or physical restraints. Restraints prevent self-harm, harm to others, and protect the milieu. They aren't to be used as punishment or for the convenience of staff. Remember restraint protocol. Never use a PRN order. Renew the order per unit protocol and provide comfort without harming the client. When physical restraints are used, you as a nurse must document the interventions attempted and the care given during restraint use. That includes routine assessment of physiologic needs and how the client responds. And a staff member must be present with a client who is restrained. In assessing the risk for violence, the most important predictor is past history. Other risk factors include medication noncompliance, substance use, and active psychotic symptoms. The therapeutic relationship is the means for implementing the nursing process. Think about that. The key intervention is your use of interpersonal abilities to establish an ongoing rapport. That's a mouthful, but basically, it's what's behind your words that counts. It's your tone of voice, your nonverbal behavior, it's your genuine and non-judgmental demeanor, and your ability to interpret what your client is telling you and what your client isn't telling you, but is showing you non-verbally. The phases of the nurse-client relationship are distinct and can overlap when the interaction is limited. Limited interaction may occur in the emergency department or during crisis intervention. In these situations, you must establish rapport in a short amount of time, then problem solve and help the client achieve a pre-crisis level of functioning. The basic phases of the therapeutic relationship include orientation, working, and termination. Now let's look at the next demonstration. In this scenario, the nurse says good morning to the client and asks the client to step up on the scale. The nurse then asks the client if she's here to see Dr. Christensen, and the client says yes. The nurse asks what medications the client is regularly on, and the client responds by asking if she has to tell the nurse. The nurse says that everything the client tells her is confidential, but that she'll need to share important information that will make a difference in her treatment plan. The client asks if the information she'll share will be shared with the doctor as well, and the nurse says yes. The client says okay. The nurse then asks when the date of the client's last period was and why she's seeing the doctor today, and the client says that the pills she's taking aren't doing anything and that she needs something else. At this point in the therapeutic relationship, it's just orientation, establishing rapport, gathering assessment data, and formulating a nursing diagnosis. The nurse then asks if she's taken her medications as directed, and the client says, sometimes. The nurse tells the client that this particular medication requires a daily dosage to achieve the level of effectiveness that she wants. And the client says that she just forgets to take it sometimes. The nurse then asks if she takes the medication in the morning and asks if there's something else the client does each morning that would remind her to take it. The client tells her that she always puts the dog out first thing in the morning. The nurse asks if the client can put her medication and a glass of water near the door in a safe place where she'll remember it when she takes the dog out. The client says yes. The nurse has now promoted insight and problem solving, and she overcame resistance. This all happens in the working phase of the therapeutic relationship. The nurse comes back into the examination room after the doctor has seen the client and says to the client that the doctor has renewed her prescription. The client says that she guesses she'll try it again and will try to take her pills every day. The nurse mentions putting the medication in an obvious place, make it a routine like they discussed. The nurse also mentions that in the client's chart, she's going to start walking daily as well. The client says that she might as well, that since she puts the dog out anyway, she might as well walk him. The nurse suggests that the client make an appointment in 4 weeks so that her progress can be checked. That's the termination phase of the therapeutic relationship. The nurse has confirmed the course of treatment, they've progressed towards a goal, and developed plans for continued aftercare. Notice the differences between a social relationship and therapeutic relationship. The therapeutic relationship focuses on the client and her goals rather than on a friendship with the nurse. Rather than superficial conversation, it's goal-directed, objective, and time-limited. Yet, while focusing on the client, the nurse is also self-aware, aware of personal thoughts, feelings, and reactions that